My name is Aukahi Austin Seabury. I'm the Executive Director of Iola Lāhui, and I'm also a licensed clinical psychologist. Iola Lāhui means so that the people will live and thrive. Our mission is to provide culturally minded, evidence-based behavioral health services that are responsive to the needs of medically underserved, rural, and Native Hawaiian communities. And really, this is a mission-driven organization. And what I mean by that is, when we talk about meeting those unmet needs in an evidence-based and culturally minded way, we truly mean understanding what each of our communities need, especially those that are in our rural and areas where they have a hard time getting providers to be out there, especially psychologists and behavioral health providers. To do that, we use several different strategies. The first of them is we have psychologists and actually other kinds of health providers here that will directly provide those services to our communities. They have excellent training in Western practices, and they have our training in how to provide that care in a culturally minded way. So we take folks, especially psychologists that are earlier in their training, and we have them serve while we train them how to do this. We have them sent to rural communities and predominantly Native Hawaiian communities throughout the āina, and we have them train and serve together. And then when they get to near the end of their training, where they're ready to be hired, we put them in a community where they're a good fit so that they hopefully get hired on there. And that model has been very successful over the last almost 15 years. The awesome thing is that our graduates become our training faculty. One of our proudest examples is Dr. Tiffany Wilson-Landrum, who's actually now our Director of Training.
I train the incoming class of interns, practicum students, and postdocs to become psychologists.
She began with us as a pre-doctoral intern, and at that time she worked on Hawaii Island at Big Island Substance Abuse Council. As a postdoctoral fellow, she went over to Waimanalo Health Center, where she worked as a postdoc for a year. And at that time, she then continued on and stayed with them past her postdoctoral fellowship year, until we were able to invite her to come back home to work with us here at Iola Lāhui as the Director of Training.
I never wanted to leave Iola because something about it that made it still feel like home, and I wanted to stay connected. So I did 5 days a week at Waimanalo once I was employed, and one day I committed my Saturdays to stick with Iola Lāhui. And when the opportunity to come back had opened up, that's what I saw it as an opportunity and a blessing to come back to what I considered home. To again, not only practice as a psychologist and meeting my clients, my individual clients' needs, but to then next help train the next training class. I thought that was like super exciting.
Through Makawai, we've been able to offer some free services. So we do some of the care that we do is offered through third-party insurance reimbursement services, and then we also offer sliding fee scale. And through our partner organizations, so in all the different places we go, there are supportive services for folks that are uninsured or underinsured, as well as free programs that are just for outreach. We've been a partner of Papa's a really long time, and this movement of Makawai, where they're inviting in all of the different community partners to, I think what it also is creating I want to say it's been really skilled support, because it offers people support at whatever level of development they're at. And it's really encouraging innovation. I mean, because we're gathering to have these conversations with the partners, we're able to reinvigorate our conversations, even with people we've partnered with for 15 years. You know, when I was even an undergraduate, I knew that I wanted to serve my Lāhui, and I wanted to be able to do everything that I could using any skill or gift I had. So I wanted something that would challenge me, that I said, here are my two hands, Lāhui, what do you need me to do?